Back pain. At some point in your life, somewhere between 60 and 80% of people will deal with it badly and notice. It's one of the single most common reasons people miss work, and it's the leading cause of disability wide. Almost every other condition you'd probably guess first. And yet, most of the advice floating around about it is either outdated, oversimplified on the wrong picture of what's actually happening in your spine. In this video, we're covering 3 things properly. What actually causes back pain, the real mechanical and lifestyle factors, what food and nutrition patterns are actually linked to back pain risk,
since this gets oversimplified constantly, and what exercise actually does and doesn't do for preventing it and recovering from it, because some of the most common advice here is decades out of date.
Same disclaimer as always, because it genuinely matters more for this topic than most. This is general information about back pain, and the broad point is not a diagnosis.
And it can't replace an actual physical exam from a doctor or a physical therapist who can look at your specific spine, your specific symptoms, and your specific history. Toward the end of this video, I'm going to walk through a specific list of warning signs that mean you should see a doctor rather than try anything from a video, and I want you to actually pay attention to that list, because some of it matters quite a lot. Let's get into it.
Let's start with what's actually going on when your back hurts, because the picture in most people's heads is more dramatic than reality most of the time.
Your spine is a stack of vertebrae, separated by discs that act as cushions, surrounded by an extremely dense network of muscles, ligaments, and nerves that all work together to keep you upright, let you bend and twist, and protect your spinal cord. Lower back pain specifically, the most common type by far, is usually described by doctors as either specific or nonspecific. Specific back pain has an identifiable structural cause, a herniated disc pressing on a nerve, a fracture, an infection, a tumor, something doctors can point to directly. Nonspecific back pain, which makes up the overwhelming majority of cases, somewhere around 90% depending on the population studied, doesn't have one single identifiable structural cause. It's usually a combination of muscle strain, joint irritation, and a nervous system that's become more sensitive to signals from that area, without any major structural damage actually present. That distinction matters enormously because it directly contradicts the intuition most people have about back pain. The intuition is usually something must be torn or damaged in there if it hurts this much.
But here's a finding that surprises almost everyone the first time they hear it. When researchers take MRI scans of people with zero back pain, completely pain-free, healthy adults,
a large percentage of them show disc bulges, disc degeneration, and other structural abnormalities on the scan, often well over half of people in older age groups. These same exact findings show up constantly on scans of people who do have back pain, which means a lot of what shows up on imaging isn't actually the cause of the pain. It's just a normal part of how spines age, present in pain-free people and people in pain at similar rates. This is part of why current medical guidelines generally recommend against routine imaging for most new lower back pain, because the scan frequently doesn't change the treatment plan and can sometimes lead people to fixate on a scary-looking finding that isn't actually the source of their pain at all. So, if structural damage isn't usually the main story, what is actually driving most back pain? Let's go through the real, evidence-backed risk factors. The first is prolonged static posture, especially prolonged sitting. This is one of the most consistent findings in back pain research over the last couple of decades, as work has shifted toward desk jobs for a huge share of the population. Sitting for extended periods increases pressure on spinal discs compared to standing, and it tends to come with sustained muscle tension in specific areas, particularly the hip flexors and lower back muscles, while other muscles, especially the core and glutes, get underused and gradually weaker. It's not sitting itself that's the core problem, it's the lack of movement variation, the same position held for hours at a stretch, day after day. That creates the issue. The second is muscle deconditioning, particularly in the core, and the muscles that support the spine directly. Your core isn't just your abs, it's a full system including your deep abdominal muscles, your back extensors, your diaphragm, and your pelvic floor, all working together to stabilize your spine during movement. When this system is weak or poorly coordinated, your spine ends up absorbing more direct mechanical stress during everyday movements, bending, lifting, twisting, that would otherwise be shared across a stronger supporting system. This is a major reason why a sedentary lifestyle is one of the most consistently identified risk factors for developing chronic back pain, independent of any specific injury. The third is improper lifting mechanics, specifically lifting with a rounded spine, especially under load. rather than hinging at the hips with the spine in a more neutral position. This doesn't necessarily cause damage every single time. Your spine is more resilient than the popular. Your spine is fragile and one wrong lift will herniate a disc, narrative suggests, but repeated loading in a poor position, especially combined with fatigue, twisting under load, or sudden unexpected force, measurably increases injury risk over time. The fourth is excess body weight, particularly around the midsection. Extra weight in this area shifts your center of gravity forward, which increases the mechanical load on your lower spine and changes how your pelvis tilts, often increasing strain on the lower back muscles and joints that have to compensate for that shift. The fifth, and this one surprises people, is smoking. Smoking reduces blood flow throughout the body, including to spinal discs, which rely on a limited blood supply to begin with. Reduced blood flow appears to accelerate disc degeneration and impair the body's ability to repair minor damage, and smokers consistently show higher rates of chronic back pain in population studies compared to non-smokers, even after researchers control for other factors like activity level and occupation. And the sixth factor, which doesn't get nearly enough attention, is psychological stress and sleep quality. This isn't an alternative to the physical explanation, it works alongside it. Chronic stress increases overall muscle tension, particularly in the neck, shoulders, and lower back, and poor sleep is associated with increased pain sensitivity throughout the body, meaning the same physical input can be perceived as more painful when someone is sleep-deprived or under chronic stress. This is part of why back pain treatment that focuses purely on the physical structure while ignoring stress and sleep often underperforms compared to a more complete approach.
Now let's talk about food, because nutrition's relationship to back pain gets oversimplified constantly online, usually into some version of eat this one thing and your back pain
disappears. The real relationship is more indirect, but it's still genuinely meaningful. The strongest, most direct nutritional connection to back pain is body weight management, which we already touched on from the mechanical side. Reducing excess body weight, particularly visceral fat around the midsection, reduces direct mechanical load on the spine and tends to improve pelvic alignment, both of which are linked to reduced back pain risk and severity in population studies. This isn't about any specific diet plan being superior, it's about whatever sustainable eating pattern helps someone reach and maintain a healthier weight for their body. The second connection runs through inflammation. Chronic low-grade inflammation throughout the body can contribute to pain sensitivity and may play a role in disc degeneration over time. Dietary patterns high in refined carbohydrates, added sugar, and heavily processed food are associated with higher markers of chronic inflammation, while diets richer in vegetables, fruits, whole grains, and healthy fats, the same general pattern that comes up in basically every nutrition conversation on this channel, are associated with lower inflammatory markers. Omega-3 fatty acids specifically, found in fatty fish, walnuts, and flaxseed, have reasonably good evidence for modestly reducing inflammatory markers, and some research has looked specifically at omega-3 intake in relation to joint and back pain, generally finding a modest benefit, though it's not a dramatic, fix-everything effect. The third connection is bone health, particularly relevant for preventing one specific category of back pain risk, vertebral compression fractures related to low bone density, which become more common with age, especially after menopause. Adequate calcium and vitamin D intake, along with weight-bearing exercise, which we'll get to shortly, support bone density and reduce this specific risk over the long term. The fourth, and this one is underrated, is hydration and disc health. Spinal discs are made up significantly of water content, and they rely on movement and changes in position throughout the day to draw in nutrients and fluid, partly because they have a very limited direct blood supply of their own. Staying adequately hydrated supports this process, though it's worth being honest that this is a smaller, more supportive factor compared to weight management and overall activity level, not a primary lever on its own. So the honest nutritional summary here: no miracle food, no specific anti-back pain diet plan with strong direct evidence behind it as a standalone intervention. What's actually supported is the same broad pattern that supports your overall health generally: weight management through a sustainable, whole food-focused diet, adequate omega-3 intake, adequate calcium and vitamin D, particularly as you age, and good hydration, all of which contribute to back health indirectly through inflammation, bone density, weight-related mechanical load, and disc nutrition, rather than through any single dramatic mechanism. Now let's get into exercise, because this is where the most outdated advice still lingers and where the actual evidence has shifted significantly over the last few decades. The old standard advice for back pain, especially right after an injury or flare-up, used to be rest. Lie down, avoid movement, let it heal. Current evidence and current clinical guidelines have moved decisively away from this approach for the vast majority of nonspecific back pain cases. Extended bed rest is now understood to often make things worse, not better, because it accelerates muscle deconditioning, particularly in the core muscles that are supposed to be supporting your spine, and prolonged inactivity is associated with slower recovery and higher rates of the pain becoming chronic, compared to staying as active as reasonably tolerable. Current guidelines for most nonspecific back pain consistently recommend staying active, modifying activities to avoid significant pain rather than avoiding movement altogether, and beginning appropriate exercise relatively early rather than waiting for pain to fully resolve first. So, what specific types of exercise actually help, both for prevention and for recovery? Core stabilization exercises are consistently among the most well-supported categories. This doesn't mean intensive workouts. In fact, exercises that involve heavy spinal flexion under load, like full sit-ups, are sometimes discouraged for people with existing back issues. It means exercises that train your deep core muscles to stabilize your spine during movement, things like planks, bird dogs, dead bugs, and other exercises that challenge your core to resist movement rather than create it. This category of training, often associated with the work of spine researcher Stuart McGill, has a substantial body of evidence behind it for both reducing back pain and reducing the chance of future episodes. General aerobic activity, and this is one of the more consistently supported findings in the research, particularly simple walking, has good evidence for both treating and preventing low back pain. Walking promotes blood flow to spinal structures, helps maintain healthy body weight, and keeps the whole system moving regularly rather than locked into prolonged static positions, all of which directly counters several of the major risk factors we already covered. Specific structured exercise programs, including supervised physical therapy exercises, yoga, and Pilates, all have reasonably good evidence specifically for chronic low back pain, generally through a combination of improved core strength, improved flexibility, and, importantly, reduced fear of movement, since chronic back pain often comes with a learned avoidance of movement that ends up making the deconditioning problem worse over time, creating a frustrating cycle where pain leads to less movement, which leads to more deconditioning, which leads to more pain. Strength training more broadly, not just core-focused work, also has solid supporting evidence, particularly for prevention. Strengthening the muscles around the hips and the upper back specifically helps share mechanical load that would otherwise concentrate in the lower back during everyday movement and lifting. And specifically on lifting technique, since this comes up constantly, the most consistently supported general principle is hip hinging, bending primarily at the hips while keeping the spine in a more neutral position, rather than rounding through the lower back, particularly under load. Building strength in this hinging pattern, often trained through exercises like deadlift variations under proper supervision, appears to meaningfully reduce injury risk during real-world lifting tasks, which makes sense given what we covered earlier about how repeated poor position loading contributes to risk over time.
I want to be clear about one more thing before we move to prevention specifically, because it ties directly back to what we covered about imaging and structural findings.
The relationship between exercise and back pain isn't purely mechanical. Part of why exercise helps, especially for people who've had chronic pain for a while, is that it gradually reduces the nervous system's heightened sensitivity to movement and rebuilds confidence that movement is safe, which matters because fear of movement and excessive protective behavior around the back can itself become part of what's perpetuating pain in chronic cases, independent of any ongoing structural issue. So let's bring this together into practical prevention, the stuff actually worth building into your regular routine. Move regularly throughout the day rather than holding one position for hours, especially if you have a desk job. Standing up, walking briefly, or simply changing position every 30 to 60 minutes meaningfully reduces the sustained loading that comes from prolonged static sitting. Build core stability work into your week. 2 to 3 sessions of stabilization-focused exercise is a reasonable, well-supported target for most people. Keep up general aerobic activity. Walking remains one of the simplest, most consistently supported things you can do. Build general strength, particularly around your hips and upper back, not just your core in isolation. Pay attention to lifting mechanics, specifically when lifting anything heavy. Hip hinge rather than rounding through the lower back, and avoid combining heavy lifting with twisting whenever possible. Maintain a healthy body weight through a sustainable, whole food-focused dietary pattern, which reduces direct mechanical load on your spine. If you smoke, this is yet another well-documented reason quitting matters, beyond the much larger risks we've covered in previous videos on this channel. And prioritize sleep quality and stress management, not as an alternative to the physical factors, but as a genuine contributor to how your nervous system processes pain signals. Now, the part 1 mentioned at the start because this matters and I don't want it lost in the rest of the video. Most back pain is non-specific, manageable, and responds well to staying appropriately active. But there's a specific set of warning signs, sometimes called red flags in clinical settings, that mean you should see a doctor rather than try to manage things yourself, because they can indicate something more serious than typical mechanical back pain. These include back pain following significant trauma, like a fall or accident, numbness, tingling, or weakness in your legs, especially if it's progressively getting worse, any loss of bladder or bowel control, unexplained weight loss alongside the back pain, fever combined with back pain, pain that's worse at night, or doesn't improve at all with rest or position changes, and back pain that started after age 50 with no clear mechanical cause, particularly if you have a history of cancer, osteoporosis, or are on long-term steroid medication. If any of that applies to you, please don't try to push through it with exercises from a video. Get it checked out properly.
If you take one thing away from this video, I'd want it to be this. Back pain is one of the most common health issues humans experience.
And also one of the most over-imaged, over-rested, and under-exercised conditions in modern healthcare.
The instinct to protect an injured back by staying still and waiting for it to heal is understandable, but for the large majority of cases, it works against you rather than for you. The evidence consistently points towards staying appropriately active, building strength and stability gradually, managing your weight and inflammation
Through reasonable nutrition, and saving genuine rest for the much smaller set of cases where a doctor has identified something that actually requires it.
This was useful. The food and lifestyle videos on this channel take the same approach to other common conditions. Actual evidence over outdated advice. Let me know in the comments if you want a deeper, more detailed routine breakdown for either the core stability side or the nutrition side of this, and tell me what condition or claim you want covered like this next. Don't forget to like and subscribe, and I'll see you in the next one.